and welcome. You are watching Don Bosco Media Network. This is Deepika Lingdor bringing to you the news and events in Meghalaya. Let us first have a look at the headlines for today. Meghalaya implements Swachh Bharat Mission Gramin Phase 2. Blazing fire engulfs workshops at Loam Survey near Umsosun Point in Shillong. And Nasha Mukt campaign to contain drug menace in the country is being carried out successfully in West Jaintia Hills district of Meghalaya. And now the news in detail. Meghalaya government has decided to implement the Swachh Bharat Mission Gramin Phase 2 following the approval of the cabinet after a meeting held today. Prime Minister James Sangma informed media that after a cabinet meeting today, the state cabinet has agreed to follow the operational guidelines laid down with respect to Swachh Bharat Mission Gramin Phase 2. As per Rule 16 of the operational guideline relating to the release of the funds, the state government has passed a resolution that there will be timely release of state's share of the program and set up institutional management for implementation of the program besides others.
Fulfillment of the conditions mentioned in the Swachh Bharat Mission Gramin Phase 2 operational guidelines in respect of release of funds, and this matter was brought up it was made known to the cabinet that as per Rule 16 of the operational guidelines relating to the release of funds, the Swachh Bharat Mission Gramin Phase 2 shall support all states and Union Territories of India. Funds will be released to the states' UTs based on their performance and ability to achieve program results. States shall become eligible to release funds based on attainment of the following conditions. So these conditions were namely that the state cabinet passes a resolution to implement the SBMG Phase 2 and commits timely release of state share for the program. Secondly, the state has to set up suggested institutional arrangements for implementation and management of the SBMG Phase 2. Thirdly, the state agrees to devolve funds to the Gram Panchayats for co-financing of SBMG components. And lastly, develops a project implementation plan and annual implementation plan.
Prime Minister James Sangma, after a cabinet meeting today, informed media that the proposal to approve the Meghalaya Housing Subordinate Statistical Service Rules 2020 was also approved. The rule is meant to regulate the method of recruitment, promotion and service matters of persons appointed to the posts of Assistant Research Officer, Research Assistant and Investigator in the Directorate of Housing.
The proposal to approve the Meghalaya Housing Subordinate Statistical Service Rules 2020. The Meghalaya Housing Subordinate Statistical Service Rules 2020 is meant to regulate the method of recruitment, promotion and service matters of persons appointed to the post of Assistant Research Officer, Research Assistant and Investigator in the Directorate of Housing. This was framed by the department and was placed for the consideration of the cabinet. The views of personnel in and AR departments, the law department and finance was sought, and they have all given their approval to the service rules, and this was approved by the cabinet.
The Meghalaya cabinet today announced the names of the Meghalaya Day Award recipients for the year 2021. This year's winner of the U Tirot Singh's AIM Award in Arts and Literacy is Rafael Wajri. The Patogan Sangma Award for Social Service is Reverend Dilseng M. Sangma. Meanwhile, the U Kyang Nangba Award for Excellence in Sports will be awarded to Hame Shania Suya.
By the Advisory Committee for the U Tirot Singh Award for Art and Literature, the Patogan N. Sangma Award for Social Services, and the U Kyang Nangba Award for Sports. And the names which were given were Shri Rafael Wajri for the U Tirot Singh Award for Arts and Literature, Reverend Dilseng M. Sangma for the Patogan N. Sangma Award for Social Services, and Shri Hame Shania Suyam for the U Kyang Nangba Award for Sports. and games. So these were approved by the cabinet, and these names have been approved by the cabinet.
All gaming activities in Meghalaya will be regulated following the approval of the Meghalaya Regulation of Gaming Ordinance 2021 by the Meghalaya Cabinet today. Briefing media after the Cabinet meeting, Power Minister James Sangma informed that this step will help the state government increase revenue collection. He said that gaming that are carried out online will also come under the purview of the regulation.
So in this, I'd like to inform you that in a bid to increase revenue collection by ways of improving the existing taxation acts and through embracing the usage of technology, and also by tapping new resources to generate revenue, the taxation department has seen that through the use of information technology, gaming today has emerged as one of the most popular pastimes globally, and Meghalaya is no exception. And the gaming through the use of information technology generates revenue to the entity involved in the operation of online gaming server through acceptance of stake money and advertisements. So in order to regulate gaming within the state and to bring revenue to the state government, we felt it necessary to enact a law for the same, and therefore the draft ordinance was placed in front of the cabinet for its approval. And the views of the law department, the finance department had been sought, and both have given their approval to it, and it was discussed today in the cabinet, and the cabinet has approved the proposal to notify the Meghalaya Regulation of Gaming Ordinance 2021.
The National Health Mission and UNICEF today organized a half-day media sensitization workshop on COVID-19 vaccination drive at State Convention Center in Shillong. The aim of this workshop is to sensitize media persons of the vaccine. Many of the incidences have occurred due to lack of awareness among the public, and the role of media can be utilized as a powerful tool to combat rumors. The State Health Department will officially launch the COVID-19 vaccination drive on the 16th of this month on a phase-wise manner across the state. In this regard, the COVID-19 vaccine has been developed to help tackle the COVID-19 pandemic by protecting and preventing the disease from spreading further. Present at the workshop was Shri P. Sampath Kumar, Principal Secretary, Health and Family Welfare Department, Meghalaya, along with Joint Director, MCH and FW, cum Joint Mission Director, NHM, Dr. P. Manar, State Immunization Officer, Dr. N. Roy, SMO, WHO, and representative from UNICEF and media person from different media houses.
The Government of India has done, very visionary, step was, while taking the measures for containing this pandemic, Government of India also has actually invested in actually finding, a solution through, vaccination programs, actually, investing in how actually we can, produce a vaccine that can prevent and contain this, this particular disease, which doesn't have, basically essentially it's very infectious and doesn't have a, a kind of a, solution, except that we are dealing with isolation and, some kind of a emergency critical care. So based on that, the Government of India has come up with, two vaccines have been authorized. I think you're all aware of the two vaccines. One is Covishield and another is Covaxin. And these two vaccines are being distributed across the country. And we, Meghalaya, in the state of Meghalaya, we have got the Covishield in the first phase, 35,000 doses. And these 35,000 doses also are going to be distributed, in fact, in a manner that very systematically. In the first phase, we are covering the healthcare workers. That healthcare workers means healthcare workers both in the private sector and also the public sector. So we have about 27,000 healthcare workers are there within the state government domain. And then we also After the first phase, we'll be extending this vaccination drive to the frontline workers. Frontline workers includes the police and the municipal workers and the disaster management people. So this is again the other second phase, and the third phase is for those above 50 years and those with comorbid conditions, because for them it is all the more important. So that's why the third phase is that. So this is the kind of a plan that has been put in across the country, not only Meghalaya. So that is the way actually we are going to do this. But like now today's meeting is essentially about talking about how this entire vaccination program is going to be rolled out. And why? First, maybe we can actually have a discussion. Especially this is a workshop for making people to understand, to bring awareness and also to bring that acceptance and to bring that entire mobilization. This is a very important thing. So one of the things you are aware, why actually we do give vaccinations. Let us start with the fundamental starting point. Like if you look at it. See, Meghalaya, we in fact last year we have achieved the vaccination program that actually we conduct for the children, because that's a very important thing. Many of the children die because because of many diseases which do not have a cure. Which do not have a cure. So vaccination is essentially something that for example polio. So polio we have eradicated. At least in Meghalaya there is no polio. So the vaccination program is that way it is so important for the people to prevent from those diseases, especially which do not have a cure. So last year we had very good experience of actually vaccination program. In fact, Meghalaya was actually lagging behind in the full immunization of children at some point of time. For various reasons. Then actually we started bringing that awareness among the people about the need for the immunization, need for the vaccination. So today actually we are one of the top performers in the country in terms of the full immunization coverage of the children below 1 year.
Sri Arden Miller Basaimoy, a political leader, on Thursday, 14th January 2021, released a booklet enumerating the issues which he will be championing in the future. Speaking to the media, he said that the most important issues that he will be looking forward to take up will be the ILP and the need to emphasize its significance, the health hazards of uranium, and the 8 others which will be made public through the booklet soon.
Apa ni gajah beri gojingi, kabasau gajing kun percaya ke bamsap, bat gajing penklain ban penzoto iki pai ba ya gajing don kam jengko clean politics, kabasan gajing penchai pai ba bakin sengutu shai balai ni don kam ke airline permit, kabadi kau ini gimat ke bangili jekren, la slemba, bat kamtam nak kaleng jonga lengan kaleng gari kasi ban penchai, te ni don kam ban penchai, kawan riu gajing don kam ban pen ki imbiang ya akor ke burom kasi. Kabanyo ka jing pen kanmawi ka kamram jingi badle khot lakalong gi yeng ka sem ka shno ka khaw badi gari ka jat bri hibro badi gari hibro koi ka ba phra ka jing pesu thu kumnu bangin long ka jat bri ka ba trishitom khram bangin kiu ba te lakam ya ka yo kot ka ba khandai kalong ban penchai ban beteng ban penchai ki pai ba hai ka badi ka jingma ka ba mi na ka jing ti uranium bat ka ba shipo kamat kalong ban pesu thu ya ki pai ba hakari ka jingi ya la ka jing ki parado ki persnam ya ka jing don kam bangin phai shublei ko ba kilong shwa man shwa kila sengnung rim bangin long ka jai berite play kini kilong ki sportly ki mat ki ba ngala shu sot lingkot nakani ka kot ding kadok ka ba ngila palai pai ba tementangin sam ko jingi tekani ka ba ningkong ka bangi ko ban panai ka kam ka bangi sedang nam takani ka revolution ya dala kari ka ba arpat namar ba kidon shibon ke bala pensngo he kini kisngi kumnungi kwa ban ngi kwa ban nirung hakani ka revolution ni dala kari te bat kumba philatip shai hangni ru idleng bai ni ka drop de phila police bit ngila sam kani gamri ke seng ten ring in hapat ban where yaki ya ki parado ki parasnam ki la ki nong ki samla ki nong kmi ki romba ki bokwa bani shim benta pat hakani ka revolution ya kata ngin sa penbe hakani ka teu banon kumnu bangin ngin wer ngin khot ya ki bri ki bokwa ban shim benta bakin ai kerteng mo te namar ba kanu nu ka jinga linti ke jinang ni smart kan haplong hi da ka linti ke be te ngimla ban shu ya be tang nasla tamangi ki no lam mot ki pai ba ki bokwa ban shim benta khana bakin don benta hakita ki jingpun kre ki jingi ki bangin ngya nang ni smart ka don kam e ka jingpun su tho ki pai ba ka don kam ka jingpun kre ka jingi halor kumnu bangin ni ki khanang bangin la ban pun orlong ni ki jing ang nu ki jingi
Shri Niman Shadap, president of the KGNU, has filed an FIR with the police, stating that he was held at gunpoint by a leader of another pressure group when members of the KGNU has stopped a vehicle carrying cattle in Umulong. As per Shri Shadap's report, the incident took place on 13 January 2021, where the accused even threatened to endanger the lives of his family members as well.
Pan hadin kata ki bu ke FIR hapo Umulong Bit House. Hadin kata ke jing yo bat jong ki khot yang abangan ban pe je kata ka kam habangawan hang ta hadin ke jing kren baru deploy. Uong yinga sa pha ki membar jong me ba kin withdraw no ikene ka FIR persya ikili kit mesti jonga. Tengah ong ye uba ye kata ngam la arban rai ngam la arban ong namar bamde banga babat der banga bakem. Tu ong ba hadin kata hagajing ya kren jong ubat kini ki khot ngam tip ye ke bagi ya kren hadin ka kumba nyo siteng ne prav je tu upersang bantan yang sepok ka kali Scorpio jong u bodon yu number ML04C 9996 tu persang bantan yang ong M lada pikwa ban kren hang ne bodon ki pai ba rulong tong tahun dah lah tan kedet nomor ba dekat pos kapor ngiju itu tahun dah lah ya kam kedet upedi ya ka pistol mah uang ba la da me mempa iki memba jam me ban withdraw ya ke ka FIR persya ini ki kelikit mesti jonga ngan simi ke jingim jong me bat iki ke ying kesam jong me mde bu maham tang bat ye lede mde maham bat iki ying kesam jonga bat iki khot jonga barok tengok ia kata takam lele nomor ba ada ublai umon ban ai ke mensum jong akhri jong me kalong ia kata ka jing yak ngam tip mo nomor ka jing imbruhi ni ka jing yak ngim la ban bu trik ngim la ban bu sni ia kata ngim septing ra ngin mi bet ta yikir kho jong aru nga na ka por ngaju pha bat ngiju kren ru bat lomba kilap thai ku baru yikikam be anhi ngi ngin khanrabe na ka por ngimong ba ule khot sang bhalang ne di rusimet ne di officer ne nomor POE ba mentang hapok ke jela jongi la kharoi kini ki kam be an neduk khamtam ki mesti ki wan neduk asam lang ba ka lenti jong ka jela Meghalaya jongi ban selan siduk Bangladesh bojo ni ubri udepoi hang ne POE ba ka atrik brau khat arjar khat kendai Beliau jong SP Superintendent of Police jong ka Eastern Tiaru ula de bu FIR persya ni ubriu ta hang ni nga kerpat ya ki bor jong kan sim ban kem yo ni ubriu ne ban pensitom kat kum kendon jong kan.
3 vehicles and motorcycles were gutted by fire when wildfire engulfed the garages, workshops and steel fabrication shops at Loam Survey near Umsosun Point in Shillong after midnight. One of the shop owners, who did not want to disclose his identity, said his machineries worth more than 20 lakh rupees were reduced to ashes, and a family that looks after his shop was temporarily shifted to a temporary dwelling place next to his gutted shop. Eyewitnesses said they saw the inferno emerging from the middle of these workshops. The firefighter rushed to the spot to douse the raging flames but could not succeed, as these workshops were made with old wooden structures. After the fire incident, the property belonging to Sawian clan was fenced by barbed wires. The Nasha Mukt campaign to contain drug menace in the country is being carried out successfully with various awareness programs in West Jainta Hills district of Meghalaya. The success of these programs has been attributed to the hard work of District Social Welfare Office along with the cooperation of NGOs including the Manbha Foundation Jawai Society for Urban and Rural Empowerment Jawai, Industrial and Institutional Ministry KJP Sinot Meetngi Jawai, and Suncare Jawai Unit. A campaign in this regard was held today at Minthong District Library, Jowai, in which a large number of students participated in the function organized by Society for Urban and Rural Empowerment, Jowai. Those who spoke on the occasion included Dakapaya Bare, Field Coordinator of SURE, Jowai. She spoke on basics of drugs abuse and addiction. Lucy Ksu of Scope Foundation Mukla spoke on the ill effect of drugs abuse on an individual, family and society. Dr. J.N. Shulai, Directorate MCSWA Jowai, spoke on the effect of drug abuse on health, physical, mental, symptom and treatment. On the other hand, B.R. Marak, officer in charge of Jowai Police Station, gave a talk on Narcotic Drug and Psychotropic Substance Act.
Immediate response, low ability to respond to situation wrong. The need to employ ongi. Mandadi pini Jowai maham ya kari mo iyam ta ongi lokju. Pi to yu ya kari or kalau betul di nak ada mate kamte ni ongi. Nei ha wa kini ki Jowai kam tin ni ki khud ki depression na kita tak ha ko ya ka central nervous system yoni. Yai jabe roi ni tei jo. Ta ki halu sunni jen kan tu wan tu dia kom senyau yang pi. Ye ki yu một cam ni tem một cam ni yu itu betai ke kong ni le sam chi chu chu pi di bo ong pi wa tu bo tu la do bru wa di ye kini ki kenja do wai ye kini ki jai drugs ta ki yo one ude yo bi ude yo lagi no ude yo em hai dia medan la no man lai rup sen na ta yut ta kiet wat teu sen na một đợt ta cái ni betai kong ada kai ki phai te you may see or hear things that are not.
Well, dear viewers, that is all we have for you today. Until we meet again, thank you for watching.